Hey folks, it's Patriot Nurse. Quick tutorial today, how to put on a tourniquet. Reasons why we would put on a tourniquet. Gunshot wounds, traumatic injuries, something that would necessitate stopping bleeding. Hemorrhagic death is the #1 cause of preventable death and trauma. And when you're talking instances where you may have large numbers of violent people and groups of people, for instance, in close quarters who have animosity toward each other and there are firearms and weapons involved, it's probably a good idea to have a tourniquet on you or in proximity if you're going to events where that may be the case. So tourniquets, there's a lot of bad press about them. I'm just going to tell you what to do. The days of direct pressure and elevating and stuff like that, nope, we're going to ignore that. You got blood that's spurting from a wound, or you've got large amounts of blood and puddling blood around people. If you can isolate that injury to a limb, meaning like an arm or leg, you can apply a tourniquet. That's the only place we apply tourniquets. We're not tourniqueting necks unless you really don't like the person. That's a joke. When you're talking where to apply a tourniquet, you're going to go on the highest level of the affected extremity. Okay, highest level of the affected extremity, staying off the joint. When you put your tourniquet on, especially if you're working one-handed, put your windlass on the outside, okay? Take the slack out first. Be very aggressive with taking the slack out. Take it out first, and then with your windlass, you're going to crank. I'm not going to go the full turn because my arm hurts. Don't crank more than 3 times. 3 times the max. If you're cranking more than 3 times, you didn't take enough slack out, okay? When you crank down on the wound, you will know that your tourniquet is successfully applied. A, when the bleeding stops, and B, when you don't have a pulse downstream. So it will be uncomfortable, but at least the bleeding will stop. And when it comes to applying tourniquets, we do not take them off. Okay, once you put that tourniquet on, your goal is to evaluate the patient and make sure that there's nothing that you missed, because you can very easily become distracted. Boy, this is very easily become distracted with wounds that have a lot of bleeding, and you can miss things on the person. So make sure that once you put that tourniquet on, that you're checking for other bleeds and places on them that you missed. But also your goal should be to get them into a trauma facility, get them to the trauma bay. For my EMTs and my paramedics out there and my trauma nurses and flight medics, y'all are very critical in that infrastructure. So thanks for being part of it for sure. But guys, the CAT or the soft T wide are the ones that I recommend. And if I didn't recommend them, there's a reason for it. When you're looking at getting prepared for events like the ones that we're seeing tomorrow in Virginia, and also other events around the country where, I mean, frankly, if you strap on a gun every day, you should have a tourniquet with you, or at least some medical kits. If a person cannot or will not carry a firearm, they need to be your mule for carrying medical supplies. The end. End of story. Nobody gets a free pass on this. So that's how to put a tourniquet on. I hope it was helpful for y'all. Keep your head on a swivel for the days to come, and we need to be prepared. For now, it's Patriot Nurse signing off, and I'll see y'all later.